The nice part about IMS is that they don't have as big of a fertility space, so it's nice that we've been able to build to what it works well for us. Just that work of doing the back and forth with the IMS team, which have been fantastic on the development side and the IT support, to talk about what we're wanting to achieve and to build it. So that takes time and it takes meetings, but the fact that the IMS team is willing to put in that work with us and understand what would make things better has been great.
For me, it's the billing parts because it makes it very simple for not only the patient side to read as well as the clinical side versus the billing side.
Opportunity to sit with Spring Creek and watch them grow using IMS. When I first started, they were not using IMS at fullest, and we still have a long ways to go, but we have implemented so many functions and features that it just makes patient care that much easier and what clinical functions flow much more streamlined.
On several levels, it's impacted how we interact with patients using the portal. You know, there's a lot of patients that no longer want a phone call to discuss what's going on with them. So continual use through the portal to communicate between the staff, the nurses, the billing team, and the patients has really made it a quicker process and not as much back and forth with the patient and allows them to respond in an easier fashion. On the business side, I love the reporting option. So I love the ability to pull up reports and kind of customize them to what I want to do. So I can really have a true read on on day-to-day operations and understand places that we might be, slacking on and ways to actively watch any kind of initiatives that we have to see if they're working and then regroup. And I'm a very analytical person, so the fact that I have the capability to do pretty much any report I wanted to do is really nice.
For us, because we bring on practices, we're able to streamline what those practices look like, even though they're individual practices and don't necessarily work in the same capacity. IMS is so customizable that we're able to look at things the same way, but different all at the same time. I think because we're able to provide our patients with very clear-cut financial packages, it makes it easier for the patients to not have to necessarily worry so much about the financial pieces because they don't have to jump through a lot of hoops to understand what that looks like for them.
We have grown so much over the last, 5 years of being with Spring Creek, and the demand has grown and seen a huge impact on using all the features that IMS has in our patient care. Definitely allowed us to have better patient outreach, communication, giving patients portal access and texting and emailing capabilities, as well as telehealth. Has really been a huge impact for our patient care outreach.